everyone, it's Dr. Campbell. I'm back with another CCA exam review. Today we're focusing on part 4, which is domain 3, health records and data content. For domain number 3, there are a total of 9 tasks that you should be able to perform. Let's begin. First, retrieving medical records. So I think the first thing that's important for you to note is with all types of medical records, identification systems are actually linking the patient to their health record. And that health record today, guys, could be a paper-based health record or it can be an electronic health record. As it relates to retrieving the medical record that is paper-based, you'll need to know that there are essentially 3 types of identification systems. Those identification systems are either numeric, alphabetic, that's ABC order, or alphanumeric, which is a combination of numbers and letters. So if you're talking about a paper-based system, you'll have to know how that record is identified as it relates to that organization so that you can then determine how you are able to go and retrieve the health record. Now, with electronic health records, it's a lot easier because generally you are typing in either the patient's medical record number or you're typing in their name. The health record from an electronic perspective has a variety of ways that you can look up the record without having to leave a computer station, whereas in a paper-based world, of course, the record could be misfiled or missing, and so the paper world presents more of a challenge. All right, the other thing that I think is important to note is that doesn't matter whether it's paper-based or electronic, there are certain ways to kind of organize the health record. And so this is important because you're also expected to be able to assemble the health record. And most health records have administrative and clinical components. The administrative components is where you have all of the billing information and your consents, advanced directives, and then the clinical portion of the record is where you have all of the documents from the clinicians that are involved in treating the patient. But also you should note, and this is something that you'll see commonly in a paper environment, is that the order of the record could vary. In some instances, you may see that the organization has a source-oriented health record. Source-oriented health records are actually grouped together according to the point of origin, meaning the source. Then we also have a problem-oriented record, and you probably figured out, okay, problem-oriented means the record is organized by each problem that the patient has had. So it's kind of like a itemized list of the patient's problem from past to present. And then the last type is integrated, and integrated, the easiest way to remember this type is that it's organized in chronological or date order. So now that we've talked about retrieving the medical record, assembling the medical record, the next thing that you have to know how to do is to analyze the record. Now, there's 2 ways to analyze a record. First, analyzing the record from a quantitative perspective, which is looking at if the record is complete and accurate. So here, what we're talking about is, are there any missing reports? Are there any missing forms? Are there any signatures that are missing? And with regards to quantitative review, this analysis could actually be performed concurrently. That means while the patient is admitted to the hospital, it's being reviewed daily, or it can be reviewed retrospectively, and that's after the patient is discharged, and that's going through the record from beginning to end to make sure that all of the forms and the reports have the correct patient identification number, you know, their name, date of birth, encounter number. All the forms are present, accounted for, they're signed, and so either or approach can work. A fair amount of organizations are going to do their analysis from a quantitative perspective after the patient is discharged. The second type of analysis is called a qualitative analysis. And qualitative analysis is really monitoring the quality of the documentation. Now, one thing about qualitative analysis, this analysis is not only performed by HIM, but it can be performed by risk management. It can be performed by providers, just to name a few. And here, think about this from a legal perspective. Think about, we want to make sure that this record is quality in the situation where we might have to respond to a subpoena. Okay. All right, next up, perform data abstraction. And so I guess one of the things that you probably should remember regarding the data that is being collected for the patient is that there's a variety of reasons why the data could be used. So for you guys as coding specialists, you are abstracting the patient's diagnoses and procedures so that you can turn them into code numbers. Well, in the record, we also have things like information that's needed for cancer registry, birth registry, disease registry, death registry. So you should understand that abstracting the data is not just for coding. Oh, it also could be used for reporting purposes, reporting to a regulatory body. Next up, requesting patient-specific documentation from other sources. So other sources, I like to call this like external records. And external records could be records that the provider has maybe referenced from another organization. It could be records that patients bring in. It could be the patient having access to their personal health record and they're providing that information. And so you need to know essentially who that external body is and what specific information you need, because you don't need to request the patient's record from birth if you're only trying to figure out what happened to them last week. All right, next up, retrieving information from the Master Patient Index, aka the MPI. So as you guys should know, the Master Patient Index is a permanent record of all patients that have ever been treated at a healthcare facility. We in HIM coding, we use the MPI number for a variety of reasons, such as looking up the patient demographics, dates of care, and other information that is needed. Now, AHIMA has really done a great job of kind of laying the foundation for us relative to MPI and what elements should be collected. And as we've gone from a paper-based MPI to an electronic MPI, there are other items that are being collected, but commonly you're going to see the person's name, date of birth, gender, their race, their ethnicity, their address, their telephone number, social security number, the dates that they've been admitted or seen or discharged, and how they were discharged, like did they die or did they go to a nursing home or were they homeless? And so the MPI, just kind of as a sidebar, this is actually something that should be maintained forever. MPIs are not destroyed. All right, next up, educating providers in regards to health data standards. So one of the things that you'll have to know about our providers is that they are not trained on all of the different data health information management rules and regulations like we are. And so we have to educate them on some principles of health records, health data. So we have to make sure that they understand the importance of their records being completed timely, that the information is accurate, that the information is complete. And so it's our role to educate the providers on that, because keep in mind that we have to answer to different regulatory agencies, and we want to make sure that we're able to meet all of the standards that we're expected to meet. Lastly, guys, is generating reports for data analysis purposes. So you should know that data is very useful in providing information to the organization. And so, for example, the data of 98.6, that doesn't mean anything until you put a label on it, right? 98.6 could be someone's grade. 98.6 could be a patient's temperature. And so it's very important that you understand the different types of administrative and clinical data that can go into a patient's record, because you may need to generate reports that are going to be analyzed. So a couple of things you probably should be familiar with are the different data sets, such as the Uniform Hospital Discharge Data set, the Uniform Ambulatory Care data set, the data set that is used for emergency department services. You also should know, when you're being asked to generate the report, you need to understand why this report is needed. What is its intended use, so that you can query the system to generate all the specific data that is going to be needed. All right, guys. Well, this has been your CCA exam review part 4, domain 3, which focuses on health records and data content. Next up, you will have domain 4, which is compliance. Thank you so much for listening, and have a great day.